Hi, my name is Dr. Lawrence Bagnell, and I'm a practicing chiropractor in Langhorne, Pennsylvania. I'm also co-developer with Dr. Karen Bagnell, the Bagnell technique, which assists the mother-to-be during her pregnancy care. Today I wanted to discuss to you a little bit about pelvic torque and the distortion and how it can affect a breech presentation baby or a baby that is not in a normal vaginal delivery position, and how it can affect the overall health of the baby and the mother during the delivery process. You need to understand is that the baby in the uterus is kind of like a balloon filled with water, which is suspended by ligaments that's floating right here in the pelvis. These ligaments attach to various areas of the spine and the pelvis to help support that baby. One of the important things we found during the development of the Bagnell technique is that if there are any misalignments in the pelvis, or if there is any torsion to these ligaments, they can cause torque to the uterus, or torsion to the uterus, which in turn can cause restriction during the baby's natural movement. What we discovered is, by unlocking the torque in the pelvis, it takes tension off the ligaments that are suspending the uterus, therefore allowing the baby to turn or move or have natural movements in the uterus.
Hi, I'm Elizabeth Soskin, and I'm a midwife that's been working with mothers and babies since 2003. When I met Dr. Larry Bagnell a year and a half ago, I learned that him and his wife had developed a wonderful technique for working with supporting the uterus are not in the proper position. The baby inside must compensate its position, many times resulting in a malpresentation of the child, thus making birth more difficult for the mother and the child. Pelvic torque may account for many of the typical end-of-pregnancy pains. Sciatica pains and numbness of the legs may also be affected. Estrogen and relaxin will naturally encourage the pelvic muscles and ligaments to relax during a pregnancy. And chiropractic care can help pregnant women by keeping the pelvis and spine in line to avoid unneeded pain and difficulty in labor. Pelvic torque leads to the stretching and pulling of the uterus and muscles supporting the uterus and the pelvic floor. When the ligaments that connect the uterus to the pelvis are being stretched and torqued, it can pull the uterus in an unnatural position and the baby inside that's being supported. Pelvic torque many times includes the sacrum, which is the back, this part of our bodies, and the pubic bone and arch in the front. But when the pelvis is torqued, literally like this, uneven, how is a baby supposed to fit through there when the pelvis is supposed to be aligned and straight? When the pelvis is torqued like this, we are actually reducing the size of the inlet and the outlet for the baby to travel through. Chiropractic care is gentle and non-invasive for pregnant women. Regular pelvic adjustments will encourage the fetus to position itself in the proper position for birth. Can help keep mothers and babies comfortable and safe. Pregnant woman's pelvis is stabilized. It may greatly reduce the aches and pains caused by pelvic torque. It will also reduce the chances of her needing to have an emergency C-section.
So one of the questions we're trying to answer for a pregnant mom-to-be is, when they first come into the office, is, what are you going to do? And one of the things we try to explain to them is that we're working on their nervous system, their brain and spinal cord, so that the messages from the brain can be sent and transmitted down the spinal cord, not only to every part of their body, but including their baby. And we also want to let them know that we're not here to harm them. We're going to use something called a gentle chiropractic adjustment, and part of Bagnell technique uses gentle adjustments to realign the bones and realign the pelvis so that the baby can find its natural position. And that is one of the reasons why we've had a 95% success rate in babies turning to their natural position and helping moms-to-be avoid C-section. And you know as well as I know how important it is to have a natural childbirth.
I sure do.
Because it puts so much stress not only on the mother, it puts stress on the fetus or the baby to be born. And that in itself can lead to many problems later on in life. So if we can prevent those problems while the mother is pregnant and allow the mother and the baby to have a natural, beautiful pregnancy and a delivery, it makes life, I think, just and the world such a better place, because anytime we can avoid surgery, that is a plus. Do you have any comments at all about how chiropractic has helped you over the years?
Well, I've been seeing chiropractors for a long time to help stabilize my hips. Like many women, we tend to have very flexible hip joints. So even though I'm not pregnant, I find that I have my own pelvic torque, and that it causes a great deal of pain in my lower back and in my hips. So by having regular weekly chiropractic adjustments, I find the pain that I feel in my lower back is greatly reduced. So I can only imagine for my pregnant clients that the pain that they're feeling due to the increased relaxation of their pelvic muscles, ligaments, and bones, that having regular adjustments can only do a great service for them.
That's fantastic. One of the things I like to also explain to moms that will be watching this video is that the chiropractic adjustment during pregnancy is very, very easy. There's not a lot of force involved at all because of the hormones that are being released. A lot of times moms will come in and they'll have a little bit of anxiety, and after we talk to them and do an extensive consultation and examination, we also will go through the process of the pre-adjustment. Explain to them what's going to happen beforehand so there's no fear, so that we can answer and address all their questions. And then once the adjustment is done, they get up and say, "That's it?" And then a lot of times what we'll usually find out is if they have a baby that's not in the natural delivery position, usually we will find a change in their body, and in most cases the babies will turn in a very short period of time. We had, as Dr. Karen was adjusting one patient one time, and while the patient was on the table and Dr. Karen was applying the Bagnell technique that we developed, the baby turned right then and there. And the mom stood up, and just before checkout she was crying because she was so scared of having a C-section. And then, like I like to let everybody know, is that it doesn't work for everybody, but it's been highly successful. So if you're seeking a chiropractor for pregnancy, what I would suggest is find somebody that is truly certified in the Bagnell technique, and we are working diligently, Dr. Karen and I, to train more chiropractors in what we do. If you can't find a chiropractor, well then you're more than welcome to come to Langhorne, Pennsylvania, and we'll be happy to take you. Liz, thank you very much for your assistance in this.
Thanks a lot, Dr. Bagnell.